We often get the question, how long is recovery after my hernia surgery? And it really depends on what hernia you had fixed and other characteristics that go along with you and how you came to have surgery. That said, in general, people want to know about exercise after surgery and pain after surgery and when they can get back to all of their normal activities. When it comes to exercise after surgery, it's a really good idea for most hernia repairs to avoid activity at least for 2 weeks. Again, this varies depending on whether or not you had mesh, but as a baseline, 2 weeks of only leisurely walking and avoiding any strenuous activities like running, cycling, any sort of sports, skiing, golfing, all of that should be avoided for 2 weeks. When you've had a mesh repair after 2 weeks, you've generally allowed that mesh to heal in enough that it's safe to start to do other activities. It still is a good idea to approach those things slowly and kind of cautiously as you start doing them again. And if it doesn't hurt to do it, it's probably safe to do. When it comes to a no mesh repair, however, you really are relying on your tissue's own strength to prevent another hernia from coming back. And in this case, you have to be even more cautious, usually for about 4 weeks after surgery, and really take it easy, really approach everything slowly. So that's kind of getting more exercise and getting back to activity. When it comes to pain, people respond to hernia surgery differently. Some people feel minimal pain at all after surgery, and some people are uncomfortable for a couple weeks. It's hard to predict exactly who will fall into each category, but in general, after the type of hernia surgery that requires mesh, usually it's a few days of more significant pain, and that can usually be managed with tylenol and ibuprofen. For some of our patients who have more extensive surgery or who have tissue repairs, they may require some opioid pain medication in addition to those two meds. And each person is different, and we're happy to help guide you along that way. So if you do have questions, more questions about recovery after surgery, we recommend checking in with a hernia specialist to discuss your hernia in particular and what to expect will go along with your surgery, and get more answers from somebody who can guide you with the specifics particular to you.